moving because that's what we refer to as neuroprotective. All right, so John, come on in, get us moving, and then we're going to hear from our phenomenal guest. And remember, you can use the chat and Q&A function, and the session is being recorded, so we will send a link out of the session later this week. All right, John, take us away and get our hearts going. Thanks for joining us.
Hey. I want to welcome everyone to the Emory Alzheimer's Disease Research Center. Today, we are going to be in a loving moment. We're going to get that cardio in, those abs. And today, I'm going to use my canned goods for my upper body. If you have water bottles, anything around the house for a little bit of resistance, or you can just use your own body weight. So in 5 seconds, we're going to get started. Wait 1 minute. Here we go. Oh, Lord. Here we go. My thing is off. All right. Let's get ready. And this is how we started out. We're working on hips right now. Come on. And we bring that circulation. Watch this now. That's gonna run us. I just need that one leg. I need that body moving. Come on. Someone just like you. Drink. Oh. Everybody knows. There you go. Most every place I go. We gonna keep this going. But nobody seems to understand. We get no ill man say, go here, go one, and that circulation. Watch it. We lost everything. Come on. Keep the legs going. Now we really engaged. No tribulations. No out of line. Just study with me now. That's my thing. And we loosening that body up. Let's go. That's how I got my thing. But nobody seems to understand. I need y'all to rock with me. Oh, what nigga? So we can listen that way. They call me I'm in love with you. Can I explain to you? Everything's going wrong. I have to sing these sad songs. I get back to work. And I want you. And I want you. And I want you. And I want you. And I want to take you in there. Great job. Great job. Great job. Wait 1 minute. There we go. Woo! I'm going to stand up. I need that waistline. We done turned this into a day party. Hey! Right here. Forget about the dinner. The only thing I want me for, baby, is you. Come on. Just keep it coming, baby, come on. Hey, stop it, no. Stop it, keep your waistline going. That's time. I need it right now. Stop it, my canned goods. Listen, baby. Now watch my form. Let's go. Ain't no valley low, ain't no river wide enough, baby. We get that chef right now. Control this. You will go. Let's go. This way. Now we get that open chef. You don't have to worry. Oh, baby, there ain't no mountain high enough. Ain't no valley low enough. Ain't no river. I love my canned goods. Let's go. Give it up, baby. I set you free. I told you you can always count. Get it up, up. Get it up, get it up, get it up. I'll be there when you want me somewhere somehow. Let's go. Oh, baby, ain't no mountain high enough. Ain't no valley low enough. Ain't no river wide enough to keep me from getting to you, baby. Oh, no, darling. No way, no way. There we go. Just stay with me. Let's be right there. I'll be there on the double. Just choose for me all day. Right up. If you ever need a helping hand, I'll be there on the double. Let's go. Ain't no mountain high enough. Ain't no valley low enough. Ain't no river wide enough. Y'all gotta give me these last 3 minutes. I need every little drop. Here we go. I need to finish this one. Oh. You right? Hey, let's go, boy. Hey, talk to him low. Hey, come on, accent. See, I'm from the south. But some of the most beautiful things come out my mouth. And I won't say it just as soon as I come out the house. So I might as well give them something to talk about. Come on, to make a blind man believe in the book. Give me them shoulders. Give me them shoulders. Oh. Come on, get it. I want to look at that Lord, baby. Let's go. I'm also from the south. I like the big butts and goes in the house. Come on, the back room in the dirty house. If you leave the door open, mama, cut you out. Hey! Some of y'all don't know nobody choosing the road. Come on, give me what you got. Hey! 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 For 10 seconds, I want you to just do your thing. Do whatever you want to do. Go! 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Hey, happy Valentine for the whole entire year. I love to see your smiling faces. I'm John Lewis, and see you later. Bye.
Amazing, amazing. Thank you so much, John. We love having you every week, getting our energy going. Happy Valentine's Day to you. We will see you back here next Tuesday. Remember, every Tuesday we are getting you going. So thanks to John Lewis, who keeps us moving and keeps us motivated. We thank you for your energy. And I'm going to turn it over to Dr. Monica Parker because we have an exciting program lined up for you. We're going to hear first from
Carlissa.
I think it's going to be Liza first, then Carlissa. Okay, let me turn it on over. Go ahead, Dr. Parker.
Okay. Well, this afternoon, you're going to hear a little bit more about what is available for people who are veterans. Whether you are an honorably discharged veteran who's receiving your medical care at the VA, or maybe you are the caregiving spouse of somebody who served in the military, this talk this afternoon is to let you know what kind of resources are available for our military veterans. Dr. Zwiebach is from our Wounded Warrior Project. She's going to tell you a little bit more about that. Our second presenter is going to be Carlissa Carlson from Emory School of Law, talking to you about the veterans clinics that the Emory School of Law puts on to help veterans become and enroll into the kinds of benefits that are available to them as a result of their service to their country. So at this time, I'd like you to meet Dr. Liza Zwiebach. Did I say your name correctly?
You were super close. I pronounced my last name Zwiebach, but as I told Cornelya, I've heard way worse renderings of my name. You're muted, Dr. Parker. Okay. All right. So I will go ahead. First, I'll just say that John Lewis is a really tough act to follow. I guarantee that I will not be able to bring that kind of energy to this, no matter how much I try and no matter how much I love the work I do. Let's see, how much time do I have? About 10 minutes, 15?
Yes.
Okay, perfect. All right. So we can advance the slides. And so as mentioned, I'm the clinical director at Emory Healthcare Veterans Program, which is housed within the School of Medicine and Emory Clinic. And we are funded generously by Wounded Warrior Project. So we're able to, in short, and I'll talk much more about this, we're able to offer mental health treatment to post 9/11, and I'll talk about that a little bit more, but to post 9/11 veterans, free of charge to them, which is something that we're really proud of. So let me just say really quickly, invisible wounds are what we do. And that means that, or I should say what we treat. And that means that we treat PTSD, traumatic brain injury, SUD or substance use disorders, anxiety, depression, kind of this constellation of syndromes that is very prevalent among the veteran population. And so you see some of these statistics here. Current estimates are that about 1 in 3 of those who've been deployed in the current generation of returning veterans have PTSD, 1 in 5 have a history of TBI. And the suicide rate, I think, as everyone knows among veterans, is way too high. Slide, please. Unfortunately, there are a lot of barriers that keep veterans from coming in for help. And one of them is that PTSD sort of carries within it as one of its core symptoms, the problem of avoidance. People who have PTSD really have a really hard time actually thinking about, talking about their trauma. That's a symptom. What that means is that they tend not to actually present for treatment, present for help. There are also, among the veteran population and the population of active service members, is a huge stigma around seeking help. And in addition to that, or on top of that, there can be limited access, there can be inconsistent care. The VA system works wonders and also is an incredibly complex and overstretched bureaucracy. And so it's not always easy for veterans, particularly those who live in maybe underserved areas, to get the help that they need. And then finally, the treatment dropout rate for those seeking help for PTSD is historically really high. This has a lot to do with that avoidance piece that I already talked about. So in other words, there are actually and there have been for many decades, very successful, very effective, I should say, treatments for PTSD. But in order for them to be effective, people have to stick with it, and sticking with it presents a real barrier. Okay, slide. Thanks. All right, so that's where our program comes in. So Emory Healthcare Veterans Program, just some really quick facts. We operate what's called an intensive outpatient program. That's, if you're kind of familiar with mental health treatment, intensive outpatient programs, or IOPs, are pretty common models of care, kind of, as opposed to the traditional outpatient model where you go see your therapist once weekly, which we also do, and I'll talk a little bit about that. But the IOP is really our signature program. It's a 2-week program. Most of our patients go through that program, and we find that it's astonishingly successful. So first, let me talk about the retention rate. I just talked about the historically high treatment dropout rate in outpatient PTSD care. We have a 93% retention rate. So in the last slide, there's a figure like the dropout rate can be as high as 50%. The dropout rate for us is like 7%. So that's really in and of itself kind of miraculous. And a lot of that is because we just kind of throw a ton of treatment at them in this course of 2 weeks. And again, I'll talk more about that. But we find that symptom improvement, really dramatic symptom improvement, is to be expected, right? In those who complete our program, 75% show a clinically significant improvement in the 2 weeks. 85% of those maintain their improvements to below diagnosis threshold at 3-month follow-up and beyond. We also find specifically that the level of suicidal ideation post-treatment comes down a lot by virtue rather of participating in our treatment. And as I mentioned before, we do this free of charge to them. Slide, please. All right, so I already talked a little bit about this. Our 2-week intensive outpatient program is kind of our flagship program. We fly people in, even in these past 2 crazy years, even during COVID, we do this. We also offer, for those who are not able to come to our intensive outpatient program, traditional outpatient care. So that's like, you see your therapist once a week. Still effective, but we really prefer the intensive outpatient program just for its efficacy and its efficiency. We are also, again, these last 2 crazy years, we've gotten really good at doing telehealth. So we can actually implement our program now in over half the states due to some progress in providing mental health across state lines. Slide, please. Okay, so our 2-week intensive outpatient program, we have several specialty tracks within it. We have the general track, we have the PTSD track. The general track, I should say, is for people who whose primary diagnosis more is usually like anxiety or depression versus PTSD. So the treatment plans for those 2 groups will look a little different. On top of that, we have the TBI track, where cognitive rehabilitation is added to those core services focused on the primary mental health diagnosis. We also have a substance use disorder track. We're actually calling that the healthy behavior track these days. As I mentioned, we do a virtual IOP. This is a great question. Is this program available in New Jersey? The answer, if I understand your question, is yes. So we can do telehealth at this time for patients who are located in Jersey. We can also fly people in from Jersey. I'll talk very briefly about that. What about Virginia? Yes, we could. Yes, Virginia is good. I may not know offhand all of the states. Maine, I'm not sure about. Maine, I can check. Maine may not be. The New England states, I will say, tend to be a little bit more, I'll just say, stringent in terms of their mental health practice laws. Did I get all the questions? Okay. Excuse me. Let's see. So where was I? Evidence-based. Everything we do is evidence-based. So everything we do is sort of rests on a rigorous scientific foundation. We don't do anything unless we have a scientific rationale for it. We individualize all treatment plans based on a really lengthy diagnostic assessment that patients receive prior to treatment. We also provide some services that are focused on sort of a whole wellness, which I think is something that is kind of close to all of your hearts as well. Just kind of observing the activity that precedes your meetings. So we really want to care for the whole person, because it's really hard for a person to have sound mental health if basic needs are not being met. Let's see, so this question is your substance abuse treatment one-on-one or group therapy? Great question. Those components are one-on-one. We do have groups kind of sprinkled through the course of the day, but I would say most of the treatment is one-on-one. Okay, so let me advance. Next slide, please. Okay, so let's see. I'll just go over this really quickly. I mentioned we do trauma-focused therapy. We provide some medication management, again, where indicated. We also provide, if you're familiar with repetitive transcranial magnetic stimulation, this is a treatment that's been around for a while for and is actually receiving some good support in supporting treatment for PTSD as well. And so that's something that we have been doing. I mentioned cognitive rehab therapy for those with a history of TBI. We also have, as part of the treatment, some family relationship management skills. Those are offered both in groups and kind of on the level of the individual patient and his or her family. And I mentioned healthy behaviors or relapse prevention, which is really just treatment for a substance use disorder. Okay, yes, we can advance the slides. Thanks. I already talked a little bit about telehealth IOP. It's great. I don't think I need to say any more about that. I think we've all gotten pretty used to telehealth in the last 2 years. We can advance the slides. Thanks. I'll very briefly, in terms of our family piece. So I will say that our focus really is on the individual, but we also kind of view the individual, of course, in context. And so we want to make sure that our patients' families are also on board with helping their loved one take the most out of treatment and carry it forward with them in their lives. So we offer the family piece through telemedicine, as well as through kind of more traditional outpatient services. We also offer this kind of cool service called a relationship checkup, which is just like it sounds. It's a little bit of a standalone session where you sort of assess a couple's dynamics, offer them feedback, offer some recommendations. This can be for people not necessarily who need couples therapy. It can be for any of us. It's sort of analogous to a dental checkup. It's just sort of this idea of like, it's kind of primary prevention, but for the relationship versus for the teeth. Okay, we can advance the slides. All right, and I mentioned the wellness services that we offered. And these, again, we really think of this as supporting the foundation in order to make sure that the mental health concerns can actually be addressed effectively. So where indicated, where appropriate, we can provide some sleep services. We work with the Emory Sleep Center. We might have polysomnography, an overnight sleep study for our patients. We might have patients, bring their CPAP machine and have it kind of recalibrated by the sleep center. We also offer yoga 3 times per week. We offer acupuncture, where indicated, and we offer some services like music therapy. That's a fairly new service that we implemented recently. It had been less so during COVID, but we had provided a gym membership and personal training. Again, we really kind of want to take care of some basic needs so that the more complex needs are more likely to actually be served. Slide, please. Thanks. And then other things that we do, with our folks for the 2 weeks that they're there. We have some recreational activities that we do in coordination with some some veterans organizations, both local and kind of national organizations. We have this really great partnership with the Georgia Aquarium, where, you know, several times a year, our patients get to go swim with the whale sharks. We will sometimes have a sporting event, a Braves game or what have you, to take the patients to. And I will say really quickly, this is probably a longer discussion, but one of the reasons that we're doing this is not just that these things are fun, but because, PTSD can really kind of narrow one's life, really make someone kind of a little bit of a prisoner in their own home, in their own kind of smaller world. People with PTSD tend to not kind of go out and do a lot of things, especially not, where there are a lot of crowds, especially not where there can be, certain sort of entropy, right? Just thinking about what can happen, at a Braves game, for example. And so part of why we do these things is not just because they're fun, even though they are, but because this is a way of actually pushing the patients in a therapeutic way to go do some of the things that they have kind of stopped doing as a result of struggling with something like PTSD. Okay, so this question is, can this program complement treatment at a VA facility? Great question, yes. So many, if not most of our patients are already or certainly have received treatment, mental health treatment through the VA. We get a lot of our referrals from VA providers. And so our program doesn't in any way supplant the VA. There are all kinds of ways that this can work. A lot of the time what happens is a patient has, an existing therapist. Let's see, the question is, I asked because the PTSD treatment has been inconsistent with changing therapists. Yes, you're absolutely right. There can be a lot of turnover within the VA system. Yeah. Well, so this is not always the case, but a lot of what can happen is, patients may be, may have an established VA provider that they've been working with for a while, a therapist, or usually more likely a psychiatrist, somebody who's managing their meds. They come to us and, our treatment, again, as I mentioned, our treatment has a fairly short duration and is effective within that short duration. So what can really end up happening a lot of the time is that our folks leave our care and they're so much better. They may still have some ongoing mental health needs. They may still need a medication. They may still benefit from some ongoing support with a therapist, a check-in a couple times a month or something to that effect. They don't necessarily need the intensity of treatment, that we offer on an ongoing basis, which makes sense. But in cases like that, we will, kind of happily discharge our patient back to their established team or provider at the VA. So I hope that answers the question. Okay, so let's see. This is our veteran outreach coordinator staff. They are all veterans. They are charged with kind of beating the bushes and going out and making connections with veterans in the community in order to, get the word out and get patients in to take advantage of our services. Slide, thanks. And this is just really briefly, I mentioned that we are funded by the Wounded Warrior Project. We have 3 sort of sister sites around the country that offer similar programs to ours, and we're all part of the same network. So there's Home Base in Boston through Mass General. There's Road Home in Chicago through Rush University Medical Center, and Operation Mend at UCLA. And so again, we're sort of complementary programs. Each of the 4 of us have a different maybe area of strength and focus, and we work very closely together. Slide, please. Okay, research. I mentioned before that we are very dedicated to empirically based treatment, and so kind of in conjunction with that, we are, I should say, we are run by clinical researchers, by people who've been studying treatment of PTSD through clinical trials for decades. So that is very much part of our core values, I should say. We, as part of our program, we are a clinical program, but we also have ongoing research protocols. And so some of the things that we are studying on an ongoing basis are predictive biomarkers, psychophysiological response as part of the PTSD diagnosis, effective treatment on suicidal ideation. I mentioned that before. I talked about RTMS. And also something pretty new and exciting that we are starting to study is psychedelic medication as an adjunct for psychotherapy for PTSD. So really exciting stuff. This question is, do you allow Vietnam veterans into the program? That's a great question. So I said I was going to talk about this. Our primary source of funding is tied to the post 9/11 population. That means that if you've served even one day after September 11th, 2001, you're eligible for our program. Now, we, from time to time, get pockets of money from additional donors that allow us to see veterans from earlier eras, people who don't fall into that post 9/11 service category. But as I said, it's a little bit catch as catch can, right? So right now we do not have that funding. We are working on developing more sources of funding for that purpose because, well, for lots of reasons, but I will just say that the pre 9/11 veterans, Vietnam and otherwise, that we've treated do great. So there's actually, oh, I'm sorry. I have too many ums by speaker. I apologize. It's a verbal tick. I'll work on that. I will say though that the pre 9/11 veterans that we've seen do great. The data that we have on their outcomes and their follow-ups are fantastic. And so there's no difference clinically from our perspective on the era that a person served in. And that's another reason why we would really like to cultivate more funding to serve that population. Okay, I think that does it for me, actually. That should be the last of the, there's a little bit more. Actually, I don't think I need to talk about this. I already said the cost of the program, there is no charge to our actual patients. The cost is high because we provide everything. We provide travel, we provide housing, we provide activities for our patients, as well as all of the salaries of the clinical staff. I will give contact information to your question. So it costs a lot actually to put on this program, but really happily we don't pass any of that along to the people who benefit from our program. Okay, slide. Let's see, just really quickly, we've treated more than 4,000 warriors. We have provided more than 32,000 sessions of treatment. Sorry?
People want to know, we got to get to the next speaker. People want to know how they can become a part.
Is my email anywhere?
No.
Do you guys have it? Can that be sent out?
There it is.
That's what I would say.
There we go.
Oh yes, perfect. That's even better. And this says, can pre 9/11 veterans use their VA benefits? Not at this time, unfortunately. That is a long-term goal. It's a great question. Okay, so I guess that's it for me on time.
I'm going to leave your slide up for just a second, just so we can copy it and put it in the chat. What a phenomenal program and such great information. Thank you so much, Dr. Zwiebach. Tell us again.
Zwiebach.
Zwiebach. We've got it. All right. Thank you for joining us today. And we will probably have you all come back on because you got inundated with questions. So that means you have a lively and active audience.
Thank you so much.
Thank you again to the 170 plus people on right now. We're going to turn it over to Carlissa Carson. She's going to talk about the Emory Veterans Clinic and hosted by the Emory Law School. So welcome, Carlissa. I am going to, now it's really up to you if you want me to advance your slides. It's whatever is convenient for you. Just let me know.
I am happy to attempt a screen share, or it looks like you've already got it, I guess.
There you go. I just made you host and Dr. Zwiebach is still on. If you want to continue to post questions to her, she can respond in the chat or Q&A.
All right. Hello, everyone. I am Carlissa, and I am so happy to be back on BrainTalk Live. Thanks to everyone for having me. I am a staff attorney in the Emory Law Volunteer Clinic for Veterans, and we provide free legal assistance to low-income veterans located all throughout Georgia. And on this next slide here, I have to brag about my team a bit. I joined the Emory Law Clinic in January of 2020. And from that date, we have actually recovered over $5 million in VA benefits, retroactive and future benefits. And we've assisted over 100 veterans. And it's really due to the hardworking, dedicated people you see on this slide here. Attorney Jenna
Please
Breslin and
reshare. You might need to refresh.
Reshare the slides.
Yeah, we
On
can't see your screen just yet.
Does that work?
There we go. Yep, we're good.
Perfect.
Alrighty. All right. So Attorney Jenna Breslin and I are both VA accredited. So in order to represent veterans before the Board of Veterans Appeals, you have to have a special accreditation. So we are VA accredited, and our part-time clinic director, Drew Early, is also VA accredited. And Drew is a West Point Academy graduate, spent several years in the Army. I spent 9 years in the Army and have been in the Air Force since 2012. So we also have years of military experience between us, and we are happy to assist. And with that said, I want to talk about what we do exactly. We provide assistance in 3 areas. One is VA disability benefits, one is discharge upgrades, and the other is basic estate planning. So wills, powers of attorney, and directive healthcare directives. Now, when it comes to VA disability benefits, this can include a lot of different things. So perhaps you applied for disability benefits and you were denied, and you have a 1-year period to file an appeal and let your disagreement with that denial be known. So we can help with appealing a denial. We can also help with refiling an old claim. So let's say you filed a claim and you were denied and you never did appeal it, and maybe it's 5 or 10 years later, but there's some new and material evidence, maybe a new doctor's opinion, for instance. So refiling an old claim is something we can assist with. Rating increases. So perhaps you applied to VA and they service connected you for a disability and they assigned you a 50% disability rating. Perhaps you disagree with that rating because based on your symptomatology, you feel like that should be a 70% rating. And this is just an example, but a rating increase is something that we're happy to help with. Contesting a reduction is something else we can do. So perhaps you are service connected and you're 70%, you have a 70% rating, and all of a sudden you get a letter from VA saying that they're reducing your disability rating from 70% to 30%. And you might think, why is this happening? My symptoms have not improved. The condition has not improved. So sometimes you have to combat VA when it comes to a reduction. So that's something we can assist with. Now, when it comes to discharge upgrades, we're really talking about people who received a general under honorable conditions and under other than honorable conditions discharge, or a dishonorable discharge. And we like to help people upgrade those discharges so that they can gain access to important benefits like VA disability benefits. So they can, for instance, maybe take advantage of a VA home loan so that they can be buried in a military cemetery. There are all kinds of benefits that require you to have an honorable discharge. And it might be that you received a less than honorable discharge due to circumstances beyond your control. For instance, you might have had a traumatic brain injury in service, and perhaps that caused you to self-medicate. And then you got in trouble for a substance abuse problem. It could be the case that you received a less than honorable discharge because of sexism or racism. It could be the case that you were suffering from post-traumatic stress due to a traumatic event, and that caused you to self-medicate, or maybe you went AWOL because of that. So these are the circumstances where you might be eligible for a discharge upgrade. So that's something else we assist with. Now, there are a lot of things that we do not assist with, but we have partners that assist. So for instance, we work a lot with Atlanta Legal Aid Society, and they can help you with child custody, divorce issues, foreclosure. Georgia Legal Services Provider is another entity we work closely with, and they can help with things like Social Security benefits and overpayments to the government. So if you give us a call and you need help with something we don't assist with, we might refer you out to an outside agency that can help you. And we also have a low income standard, as does Atlanta Legal Aid Society. So we like to let people know that up front. All of our services are provided free of charge. And so we want to assist those that are most in need. In other words, those that can't afford an attorney. So you might wonder, well, what is low income? Well, for us, you are considered low income if you are not making more than 200% above the federal poverty level. And so you can look at this chart here and get an idea of where you are. So if you're a family of 4 and you make less than $55,500 a year, we would consider that low income. If you're a family of 2 making less than $36,620 a year, we would consider that low income. So it's based on the number of persons in your household as well as your total income. And if you are 100% disabled, we will assist you no matter your income level. So you have to be considered low income, or you have to be 100% disabled. And I heard that there were a few questions about aid and attendance and housebound benefits. Now, this is not something that my office assists directly with, but I did want to talk about it today because I heard that there were a lot of questions recently about these benefits. So VA aid and attendance. This is up to $2,400 monthly for married veterans, or up to $1,317 monthly for a surviving spouse without dependents. And how do you decide if you're eligible? Well, you may be eligible for this benefit if you get a VA pension. So you have to be getting a VA pension and you meet one of these requirements. So you need another person to help you perform daily activities, or you have to stay in bed because of an illness, or you're a patient in a nursing home due to the loss of mental or physical disability or abilities related to a disability. Or you have limited eyesight, and this is eyesight that is limited despite you having glasses or contact lenses. So concentric contraction of the visual field to 5 degrees or less, for instance. So you're getting a VA pension, and one of those things are also true. There's something else called housebound benefits. So this is up to $1,882 monthly for a married veteran, and up to $1,007 monthly for a surviving spouse without dependents. So of course, these monthly amounts change based on whether you're married, whether you have children, but you may be eligible for housebound benefits if you are getting a VA pension. So again, you have to be getting a VA pension to be eligible for either one of these benefits. And you spend most of your time in your home because of a permanent disability. And of course, that's just simply a disability that doesn't go away. And one thing to keep in mind is you can't get both of these benefits at the same time. It's one or the other. So let's say you read the slide and you thought, hey, I'm eligible for that. So how do you actually apply for the benefits? Well, it's pretty easy, actually. You can send a completed VA Form 21-2680, and you can pull this off the internet, to your pension management center. If you don't know who your pension management center is, it is the Philadelphia VA Center if you live in Georgia, Florida, North Carolina, South Carolina, West Virginia, or Virginia. So if you live in any of those states, Philadelphia VA PMC is where you need to send your VA Form 21-2680 And this is a form that you fill out with your physician. And so that's all you have to do to apply for aid in attendance or housebound benefits. If you don't want to fill this out and send it through the mail, you can actually apply in person at the VA regional office. So if you live in and around Atlanta, you can bring this form to the VA regional office located at 1700 Claremont Road in Decatur. And I included a little map here so that you can see it's between Southern Lane and Butler's Lane on Claremont Road. So again, if you live around Atlanta and you want to apply in person, you can visit the VA regional office there. VA disability, another very common veterans benefit. And as I said earlier, this is a benefit that my office does help people with. And this is up to $3,500 a month for a married veteran without children. So it's even more with children. So you may be eligible for this benefit if, as a veteran, you served under honorable conditions, you have a current illness, and both of these must be true. You served on active duty and you have a disability rating for your service-connected condition. And at least one of these must be true. You got sick while serving in the military or injured in the military. Or maybe you had an illness or injury before you joined, but serving exacerbated that illness or injury. So it aggravated it. Or you have a disability related to your active duty service, but it didn't appear until after you left service. So that would be a post-service disability claim. But basically, what we're looking for here is three things. Do you have a current diagnosis? Do you have an in-service event? And can you connect the two? So a current diagnosis, maybe you are currently diagnosed with something like lung cancer and you have an in-service event. Maybe you were in Vietnam and you were exposed to Agent Orange, and then the connection between the two. And a lot of times this connection is proven through medical opinions. So your physician writing a letter that says, Joe Smo has lung cancer and he served in Vietnam and was exposed to Agent Orange. And in my expert opinion, it is more likely than not his lung cancer was caused by Agent Orange exposure. So those are the three key elements for getting VA disability. And on this next slide, I have a few examples. So you may be eligible to get VA disability benefits for something like chronic, which is just long lasting, back pain. You know, in the Army, we do a whole lot of road marches and we pack like half of our body weight and we walk for miles and miles and miles. So that might cause some chronic, long lasting back pain. Breathing problems resulting from a current lung condition or lung disease. Severe hearing loss or tinnitus. A lot of veterans suffer from tinnitus. Some people say tinnitus, and that's something you can get service connected for. And right now that's a 10% disability rating. Scar tissue, cancers caused by contact with toxic chemicals. I noted earlier Agent Orange, and even things like a TBI, so a traumatic brain injury, post-traumatic stress, or even something like major depressive disorder might be connected to an in-service event. And so you might be eligible for disability benefits. Survivor's pension. There are also a lot of questions about this. So you may be eligible for a survivor's pension if you have not remarried after the veteran's death, and if the veteran did not receive a dishonorable discharge, and then of course their service must meet one of these requirements. So the veteran entered active duty on or before September 7, 1980, and served at least 90 days on active service with at least 1 day during a covered wartime period. So what is a wartime period? Vietnam War, World War II, World War I, even the Gulf War period, which started in 1990 and continues until this day. So you might fall into that category. Or perhaps your veteran spouse entered active duty after September 7, 1980 and served at least 24 months or the full period for which they were called or ordered to active duty with at least 1 day during a covered war period. Or maybe your veteran spouse was an officer and started on active duty after October 16, 1981 and had not previously served on active duty for at least 24 months. So one of those things must be true about your veteran spouse. Now, this must be true for you. So this applies to you. Your yearly family income and net worth is less than $138,000. And your net worth equals the value of everything you own, except for things like your primary house and your primary car, minus any debt you owe. That means you would count things like your savings and checking accounts, your mutual funds, your stocks, and your vacation homes. But these are the requirements for a VA survivor's pension. Another common benefit, and this is a benefit that my office helps people with all the time, it's called DIC, so Dependency and Indemnity Compensation. So if you're the surviving spouse of a veteran who died in the line of duty, or the survivor of a veteran who died from a service-related injury, or the survivor of a veteran who was eligible for VA disability benefits because of a totally disabling condition, you may be able to get this tax-free benefit known as DIC. And this starts at $1,437 monthly. And there are a few factors that can make that amount go up, but it starts at $1,437 a month. It is tax-free. And to be eligible for DIC, one of these must be true. You, as the spouse, lived with the veteran without a break into their death, or if you're separated, you were not at fault for the separation. So perhaps your spouse left you and it wasn't your fault, or maybe they fell into substance abuse or something like that, and it was a toxic situation and you had to separate. So something like that would not be considered your fault. So one of those things must be true, and you married the veteran within 15 years of their discharge, or you were simply married for just 1 year, or you had a child with the veteran. And so these things will make you eligible for DIC. So for instance, just as an example, if I was service-connected for glioblastoma, and that was connected to Agent Orange exposure, and I ultimately passed from a glioblastoma, my spouse would be eligible for this DIC monthly benefit. And you can get this if you've remarried, but there are a few limitations here. So if you have remarried, you can receive this compensation if one of these is true. So you remarried after December 16, 2003, and you were 57 years of age or older. Or you remarried on or after January 5, 2021, and you were 55 or older. So that's the basics of DIC. Surviving children. So it's not just surviving spouses that can get DIC benefits. But again, there are limitations. So if you are the surviving child of a veteran who died in the line of duty, or the surviving child of a veteran who died from a service-related injury, or your parent was eligible for VA disability benefits because of a totally disabling condition, you may get DIC as a surviving child, but all of these three things must be true for you as the child. You are not married, and you are not included on the surviving spouse's compensation, and you are under 18 years old. Now, if you are attending school, it's the case that you can be under 23 years old. So they raise that age limit just a little bit for people in school. All right, so I went through the basic benefits quickly, but what I really wanted to get to is an upcoming stand down for military veterans. And this is going to be a huge event. A lot of different partners are coming together to provide this event for you all, military veterans and their spouses. It's May 13 and May 14 from 9 a.m. to 5 p.m. both days. And it's going to be at the Cobb County Civic Center. And I included the address here. And this is a program that we're putting on in partnership with United Military Care. Now, this is a 100% free event, so ain't nobody going to try to put you on a monthly subscription. Ain't nobody going to try to sell you anything. Okay, no selling or charging of any kind by any vendors at this event on May 13 and May 14. Free services offered. We are offering a wide range of services. So financial wellness, If you need help with budget planning, there will be people on site to provide that to you. If you need help with fraud prevention, there will be people to help with that. Did you know that senior veterans are the #1 target of fraud in this country? And one reason is for pension poaching. So if you need help in any of those areas, perhaps a VA mortgage, legal guidance. So there will be attorneys on site to help with things like VA disability benefits, discharge upgrades, basic estate planning, Social Security, child custody, pardons, child support recovery, and even record restrictions. Maybe there's something on your record and it's a first-time offense and it's preventing you from getting a job. Well, the Cobb Second Chance Desk will be on site with us to help with things like that. Employment, if you need help preparing a resume and printing it, we can provide that on site at the Cobb County Civic Center. Food and nutrition, so long-term food assistance and even food delivery programs. Meals on a Mission will be on site. They actually give groceries to people. So rather than prepared meals, they actually provide groceries to military families. Physical wellness, if you need an eye exam, those will be provided free of charge on site. If you need a hearing assessment, those will be provided free of charge on site. We even have a licensed boxing and MMA coach in case you're just looking for something fun to do. A lot of people find that boxing and MMA helps with things like major depressive disorder and post-traumatic stress. So those services will be offered as well. Mental and emotional wellness. So some of you might be familiar with Irene Barton. She's the creator of Mind Your Mind. So she's the chair of the mental and emotional wellness pillar. And so you might need help with medication. Some people unfortunately have to decide between putting food on their table and paying for medicine. So there are programs that can help alleviate those costs. Maybe you're struggling with substance abuse. Maybe you need caregiver support. Aging in place is another area. So aid and attendance. I said earlier, my office doesn't directly assist with that, but if you need assistance getting aid and attendance, you should definitely come to this event. And also, as you saw earlier, aid and attendance is pretty hard to be eligible for, but there are other benefits where you can get up to 16 hours a week of in-home care if you, for instance, have dementia or you had a stroke recently. So come and learn about that. We'll also be giving a training for caregivers, funeral care, guardianships. Maybe you're moving to an assisted living facility and you just need someone to come and help you pack your belongings and carry boxes for you. So that's something else that you can get connected to at this event. And involvement opportunities. Maybe you're just looking for a new group of friends. Maybe you just want to develop a new hobby. So Am Legion Post 29 will be there. The VFW will be there. An organization that gives people free fly fishing lessons will be there. So they'll give you a couple hours of free instruction, and then they'll take a group of you out to the river and y'all can fly fish. Other things, homeless services. We will have on-site showers for those that just need a shower. We'll have on-site laundry. We'll have hygiene supplies. We'll have clothing to be giving away. And the kind folks at Kindred Barber and Beauty Academy of Austell, Georgia, will be giving free haircuts on site. So their master barbers will be there. So maybe you just need a haircut. And then government relations, if you need a copy of your DD-214, if you need to enroll with the VA, if you need Medicare, Medicaid, SSDI, there will also be persons on site to help you get all of that stuff squared away. And we do have a registration form. It has not gone live yet. So if you will contact us at one of these email addresses or call us, we can get the registration form to you as soon as it goes live. And we hope to see you there. Again, it's 100% free. Here's our contact information. I do see that there are a few questions in the chat. So one person said address of the event in Cobb County. Yes, it is at the Cobb County Civic Center. And let's see if I can go backwards on the slides here. Maybe not. Looks like it's not letting me go backwards here. Let me see if I can pull it up. It's 548 South Marietta Parkway, and that's in Marietta, Georgia. For the person who asked for the address, but Cobb County Civic Center. So it's in Marietta, Georgia.
Tell us the date again.
It's May 13 and May 14, and it will be from 9 a.m. to 5 p.m.
Okay, so as soon as a flyer is created, everyone, we will send out a PDF of that flyer, and we want everyone to help circulate and get that information out to friends and family. You may not be a veteran, but you know a veteran or someone who could absolutely benefit from all of those great services. Okay, so Matt Doiron, thank you so much, Carlissa. We appreciate you. She's going to stick around and continue to respond to your questions and Q&A. But in the meantime, we have CEP Live that just started at 3 o'clock. And as you know, immediately following our program, it's a separate Zoom link. So you are welcome to grab that Zoom link and head on over to CEP. You're going to be with Ayatoni. He's a physiologist here at Emory, and he's going to be doing a workout. So it's great. We started with the workout, and we had all of this great content. And now you can close out your afternoon with more physical activity, which is required. If you remember, a few weeks ago, you were advised to get 150 minutes of aerobic exercise each week. That is what is required to keep us healthy and to sustain our physical activity and our brain health. All right. So stay on a little while longer. You can grab all the information that was presented in the chat, or you can head over to CEP and join Ayatoni and our Emory colleagues on that webinar. And remember, it's a separate webinar, so it is different from this Zoom webinar, but if you have registered at least once, you're registered for their every Tuesday program at 3 p.m. And again, every Tuesday we are here from 2 p.m. to 3 p.m. We go over a little bit, but just we're always giving you such amazing information in 60 minutes. And so we appreciate everyone for joining us here. Thank you, and we'll see you back here next week. Have a great rest of the week.